So let's just go to what the content is. I would run us through what the content is for today. We're going to talk about the basics of AI and machine learning. So as simple as what some things that you don't even know are AI. And yet they are in your day-to-day activities. We also talk about AI in healthcare because it's really critical. We've seen how technology has benefited the banking sector, financial sector, for example. We've seen how it has benefited the telecommunication sector. Why not health? Right? Health has a lot to give. And so why not leverage technology and AI specifically to drive improvement in our health systems? And then we'll follow very sharply with the healthcare data. AI works with data. It doesn't work in isolation. So it's important to kind of see how those two connect together. And then we'll talk about the ethical and privacy issues that come with using AI. Yes, I think sometimes we shy away from that particular part, that there are ethical considerations that we need to hear. Someone says they cannot hear me. Can anyone hear me just to be sure that people can hear me? Can you give me a thumbs up? So it might be from your network. Okay, okay, so okay, people can hear me. So please, team, can you kindly help the person in the chat who says they can't hear, just in case it's their network or the settings on their system. And then from the ethical and privacy issues, we'll then move very quickly into our case study, just form of a discussion, just for us to kind of understand using an example. For me, I learn very well if I see an example that I can relate with. And so that's what we've infused into this as well, so that will have an example and you can ask your questions, you can make your comments. So without wasting any time, we will very quickly introduce, or I will hand you over to Mariam Umar. I believe she's the one starting, or is it Abdullah? I think it's Mariam. Yes,
Yes.
it is. So yeah, so we'll hand you over to Mariam Umar to walk us through um, the content of our presentation. Again, remember it's interactive, so in between you'll be asked a couple of questions. Please feel free to respond in the chat. And there might be a gift, who knows, right? To the most interactive person in the room might get a gift. So over to you, Mariam.
Right. Thank you. Thank you so much, Adora, and thanks for the introduction. I would like to welcome you all again. Thank you for joining this session. And I'm looking forward to this discussion. As Adora said, this is meant to be an interactive session, so feel free to ask questions throughout the session. So first, we're gonna start with what is AI? What is artificial intelligence? And I would like to give you a very simple example on how to think of AI. So AI is like a computer that can learn, make decisions, and solve problems, just like a human brain does, but much faster. So this is like the simplest example you can think of AI of. And when I say make decisions or solve problems, it's not just one thing. AI now can do millions of tasks, even better than a human does. So AI, for example, can recognize faces in photos. It can tell that this person in the photo is you, for example, or your friends or whoever. uh, AI can understand what you say or type. There are now hundreds of chatbots where you can type to, and it will understand what you text or what you say in voice. And also, AI can recommend movies that you might like. It knows what movies you will like, and it recommends these specific movies to you. So, and of course, there are a lot of other examples where AI comes in. So, before we go any further, I want you all to think of an example of how you use AI in your daily life. And please, if raise your hand and tell us the example. Anyone? I'm sure you guys are using AI. Okay, someone saying I use Claude. I use AI to do competitive research analysis. Interesting. Gemini.
So I think someone has her.
Okay.
Oh, sorry, Tim, please go ahead.
Mm. Okay, I was just going to say that for me, I use AI for a lot of things. I use AI to select music using Alexa. I use AI to look for information using Gemini. It's almost like a way of life now. You want to choose a recipe, all those kind of things. There's some AI enabled tools that you use for those things. Thank you.
Thank you. I
Thank
think we have
you.
Dr. Isaac as well. Hi, Dr. Isaac.
All right. Sorry, one. Thank you very much, host. And for AI is now becoming a way of life for most people that are really computer literate. In fact, I use AI. I still used AI yesterday, or should I say last week, for my department's presentation, PowerPoint presentation. We had a departmental presentation for gallbladder cancer, the role of palliative care, or let me say palliative care in the management of gallbladder cancer, and actually preparing for the slides for the presentation, because I already have the knowledge as a medical doctor along with my team members. AI actually helped me prepare the slide faster, at a faster rate, and help me learn how to presentation faster. And in fact, a lot of automated tasks, a lot of tasks that used to be laborious, that used to be very difficult to do, and AI is really so difficult. In fact, we are very soon, in a few years' time, apps like Canva, and the likes of it may become useless with the advent of generative AI. Because one thing AI does, so that I don't take our time, so that other speakers can talk, is that can speak, is that AI, the knowledge of AI is going to help people even with no knowledge of coding or anything that has to do with software engineering, as long as you know how to generate the prompts. What people are doing now is that the in thing today is prompt engineering. As long as you know the right prompts to use, which of course is always good to have at least the hardware or the analog training in that particular field, which will enhance your ability to use generative AI better. Once you have the knowledge, and you can combine that with the use of AI, you are going to shine. In fact, the sky will be a starting point. Thank you.
Thank you
Thank
so much, Dr. Isaac, and thank you all for your answers. So, from your responses, I see the most common answer here, yeah, is ChatGPT, Gemini, Claude, and other chatbots. Another example is face unlock on your mobile devices. So, I think this is one of the most common security approaches that all of us use to unlock our devices. Also, as some of you said, Siri and Alexa, where you can talk to it as like you're talking to a human being. So now I think we can, yeah, next slide, please. Okay, so going back to to our examples, where okay, we agreed to think of AI as a machine that can learn and make decisions. Now, one may wonder, how does even a machine learn, or how does a computer learn? So I would give you an even more simpler example here. So imagine with me this scenario. Uh, so if a child that has never seen a cat before saw a cat today, okay, will it be able tomorrow to recognize the cat? Will it be sure enough to say that this is a cat? Of course not. So when will it be able to recognize it? By seeing a lot of cats throughout the days and throughout the years, until it recognizes a pattern. It says, okay, its brain says, okay, cats have something in common actually. They have pointy ears, they have whiskers, they have this kind of tail shape. Until over the years, it can say, even if it saw a different cat, it would say, okay, this is a cat. So this is exactly how an AI learns. we make AI learn by showing it different examples, a lot of different examples, maybe thousands of photos, and then until it practices. Okay, and if it didn't recognize the photo, okay, we will give it more photos actually. Excuse me. So at first it will recognize or classify the photo incorrectly until it practices and learns until it gets smart and it can correctly identify a cat or a photo. So what we want to say here is that AI doesn't follow like a rule. It learns from the data just like a human does, just like you learn from experience. Next slide, please.
Hi, Mariam. I saw a note here. Another question is, can people put in the chat the AI platforms that they use? So what do you use? Whether it's because I saw some interesting responses. Someone said they use AI to diagnose what is wrong with their car before they take it to a mechanic. That's interesting. So please feel free to put in the chat
Yes, please.
what platforms do you use and what do you use it for? I think it'll be interesting for us to see that. Thank you. Please go ahead.
All right, thank you. So now that we have known what AI is, let's talk about two of the main types of AI that you may come across. So the first type here is non-generative AI. From its name, it's the AI that doesn't generate anything new. What it does is that it looks at the existing data and then it uses this data to make predictions or make decisions. So let's look at an example here. Netflix recommending movies. So how do you think Netflix recommends movies? Netflix looks at the movies that you have liked and it recognizes a pattern. Okay, this person has liked, for example, comedy movies. So what I'm going to recommend later is comedy movies. I'm not going to recommend other types, and so on. Google Maps finding the fastest road as well, phone face recognition, email spam filter, all of these looks at existing data and then based on this it makes decision or makes predictions. Now the other type, which is the one that's getting a lot of attention now, is the generative AI. And this AI is the AI that creates new content, such as text, images, music, or videos. So one example here is ChatGPT. You write it a prompt, and then it replies back with text, with new text. And this types of chatbots are built on models called large language models. So these are the models that generate text. Also, AI image tools, they create pictures from words. They create pictures from just the prompt that you send it to it. And also AI music tools, as we have just mentioned, where you can write a prompt on what music you want, and it will generate a new music for you. So yeah, so I hope you've had like a clear picture of what AI is now. Now we're going to talk about how AI is applied in healthcare. So I'm going to hand over to my colleague Abdullah, and thank you.
Thank you so much, Mario, for your interesting section. So now we've known what is AI and what does it do. Let's shift over to how it performs in healthcare and what can we use it for in our context of healthcare and in our facilities. So first, let's start with this question. So imagine an AI is constantly monitoring and detecting your risks, monitoring your health data, your blood pressure, blood sugar. How do you think it could impact you in managing your health? Do you think it would impact how you manage your health, or do you think it's not gonna impact it? So you can type your answers in the chat if you want. You can raise your hand if you want. Okay, someone's saying it will impact your health. Yeah, it will. Yeah, make you more conscious on your monitoring your health.
Someone said I may become
Yeah,
paranoid.
paranoid. Yeah.
So we have Satak. Satak, please go ahead and share. Please
Thank
go ahead.
Yeah, so just wanted to share my thoughts. So I feel the more information or data I have, it gives me more ability to improve upon it. If you can't measure, you can't improve. So I think if AI is providing us the information, so I think it is going to make me more, disciplined towards achieving better goals. So I think uh, definitely the predictions or like the information that I will get from an AI pertaining to health information. So I think it's definitely going to be helpful in the long run.
Okay, thank you, everyone. So everyone's agreeing it will impact rather positively or negatively. So let's say how now what can AI actually do in healthcare and how can it impact your metrics and how you're viewing it. So let's give a scenario that AI can flag those who have a blood pressure trend. It can learn from trends from your metrics. It can flag your blood pressure trends and suggest whether they're heading on like hypertensive or whether it's giving you an alert, as someone's saying in the chat, that something is going to happen before it happens. So it can alert you to it. It can help you in prediction and diagnosing the diseases, whether it's like it's like a chronic condition or just like if it's an injury that is getting worse. Streamline admin tasks in the facilities, like filling out forms and stuff like that, or even personalizing treatments. Oh, next slide, please. So one of the main thing that I believe it was said in the chat before that AI is going to take our jobs, and I know some people are freaking out on it. So AI is just a helper. It's not a hero, and especially in the healthcare, it's not going to take anyone's job anytime soon. So let's be very clear on this because it's like a common fear that in clinical settings AI can replace it, can replace a doctor and a nurse. It's not going to do it. What it's going to do is, like Mariam has mentioned, that AI can process a lot of data in a very fast amount of time and can recognize patterns. So instead of you focusing on, let's say in your facility, seeing 50 or more patients in a day, when you don't know their risks, you don't know how are they, who needs to get prioritized before who, AI can do this for you. So you can spend your time efficiently with those who mostly need it first, and not spending it on like not knowing. So it will help you get the right decision, but not take the decision for you. And now we speak about the AI in action. So what in so if your facility has sends an SMS appointment reminders, it's a form of AI. If your facility has electronic health records, it can be filled by AI. So this is more of a simple use case, an SMS reminder or flagging like something in the AHR and in the forms. It could be more complex, like taking a decision, like a decision support system. If someone has an urgent care, needs urgent care, it could flag and call someone. So let's move on. Yeah. So now we move on to our third section, which is the healthcare data. Now we have gotten an idea of the what is the AI, how it can be used in healthcare. let's understand the healthcare data. So let's talk about what is first the healthcare data. So in a typical morning, you come in, a patient comes in, you check their vitals, you take a blood test, you write a note in your file about them. This is called data. So every beep on a monitor, every blood test, every doctor's note, all of this is considered data. So it's not just one type of data, but it's a lot of types. Next slide. So imagine a patient comes into your facility for the first time. What kind of information would you need from him or from her in order to give the best treatment? So please give us your answers in the chat, or if you wanna. So
Yes, I want to see many answers in the chat. We have majority of healthcare workers on this call. So if a patient walks into your facility, male, female, what kind of information do you want to get from them that would help you give the best treatment? Yes, I see someone saying demographic data, wonderful. Bio data, health history. If you want to unmute, let us know. Are you asking them how much is in their bank account? Is that something that will help you give the best treatment? Are you asking them what they ate that morning? Are you asking them if they're the only child or the first child, or if they're a prince from Africa or the prince of England? What are you asking for that would help you make the best decision when it comes to their health? Okay, I see a lot previous medical history, clinical complaints. Well done, guys. The vitals, demographic data, previous medication. That is very interesting because I've had a cousin take some medicine that he reacted to, and that was because he was not asked his previous medication or if he had any allergies. Yes, allergies. Well done. For those who are not necessarily doctors, or you're a health administrator, you're a policymaker, if you were the patient that went into a hospital or a facility and you sat in front of a healthcare professional, what kind of information would you hope that they ask you so that you're sure that they're gathering enough information to give you the best treatment? Someone said history of hypersensitivity. Wonderful. I think we have a lot of responses. Thanks, guys. I love it. I love the interaction. Well done.
yeah, we have a lot of response. Thank you, everyone. So from all of your responses, thank you for all your responses. So you can see drug history, medical history, the sleep pattern, previous medication. So we can split the data into four sections. So the first is the electronic health records, demography, age, gender, symptoms. We can all consider it as one type of data. The next is imaging data, like X-rays, ultrasound, and so on. Thirdly is the wearable data, data from you guys who have been wearing the wearables now and the watches and stuff like that. Any metrics that are kind of recorded on timeline, time stream, like the wearable data. And finally, the genomic data, like you would see in the cancer research centers, DNA tests, racial factors, all of this sort of stuff. So where does all of these data comes from? Hospitals, clinics generate bulks of patient data through their register, cards, EMR, whether it's digital or even handwritten or physical. Labs and facilities, machines, mobile health apps, all of this can generate data, including platforms, even like apps online, like Complete Health or any other apps. All of these apps are generating these kind of data and storing it somewhere. So after this, we now move on to what now we know of all the data where it comes from. Now we talk about how do we process this data and when to feed it to the AI to bring the best answers, the best responses. So first we take the raw data, which is, as we said, like extracted, like the facilities. We take this data and we clean it. For example, if we have an EHR form that is not completely filled, has something empty or something that was filled wrong, we first need to clean it, remove any inconsistencies, make sure this data is clean. Then we move on to the next section is sorting out the data and how do we extract information out of it. So it needs to be sorted, organized in a structured format, so it moves on to an organized format of data rather than just unstructured. After then, we tag the data. We add metadata labels, like for example, that if someone is recording a metric that is high, we record that is high in the metadata. So when we come to retrieve who has the high metric, we can retrieve it from the data. And then finally, after this, we process this data with the AI to get the best responses. So if we give it just the raw data and we don't go to the pipeline, it doesn't bring the best responses, or it wouldn't affect the AI to get the best decisions. So
All right.
now we
I was wondering if we could go back to that particular slide because I think it's very critical what you've mentioned. The way it processes data, I think it's very important because sometimes what we know is, okay, yes, AI uses data and then we know what the result is. So I send a message on ChatGPT or on Gemini and I get a response. What this process is saying is this is how it filters from entry to exit. So I think it's important we look at this even as healthcare professionals. So when you're putting information, I remember Dr. Isaac talked about using AI to be able to develop the presentation that he used for their team presentation, right? He had the information, he fed the AI tool that information, and he went through the process such as this one on the screen to be able to then give him a solid presentation that he used. In some cases, some AI tools will actually ask you even further questions to further break down your information to strengthen the results that you get. So thank you for actually breaking this down like this, Abdullah, in a way that people understand what happens behind the scenes that we don't see. We just see you send something and in a couple of seconds, it churns out a response for you. This is what happens behind the scene. Please, just leave it on the screen. I think we have someone's hand up. I don't know if it's a question or if it's a comment. If it's a question, please, we would like you to put it in the chat. But if it's a comment, happy for us to take it now. Oh, the hand has gone off. Or maybe I was seeing something. Or maybe it's me that I seen AI hands up. I thought I saw somebody's hand up. Okay, but I thought it was important for us to kind of see this and just how beautifully it has been laid out. And for us to see what happens when the raw data comes in, how it's cleaned, how it's sorted, how it is tagged, and now how all that is used to then generate. Oh, it was Chika. Okay. Do you still want to give your comments? Please let us know. Okay. Please, can you raise your hand because I can't even find you on the chat. Can you raise your hand again so that to pop up on my screen? Okay, great. Please go ahead, Chika.
Okay, thank you so much, Adora. Thanks. So, I think I have a bit of confusion around this cleaning and sorting of data. I'm not sure, but maybe Abdullah can clarify because I think what I was hearing was that we have to do the cleaning and sorting for the AI. So I'm a bit confused. Are we the ones to do the cleaning and sorting before feeding AI to process, or when we feed just, raw, unclean, disorganized data to AI would do all of these processes before processing? I think I need a clarification, please. Thanks.
Yeah, so that's a very interesting question. So you can do it other ways now. So AI can be the one filtering and doing all this process until it comes with you the decision. AI can be the one filtering and sorting out the data, and then another type of AI is taking the decision, or one can go through the whole pipeline. So you don't actually need to do it, but the AI always does it in the back end to give you a clean answer.
Thank you. That's it. At this point, the possibilities are endless, right? So if you have scattered data, it's like having a room. You can have a room that is scattered and you have a professional cleaner come in and make it clean, or you can have one that you've given some form of a direction and then someone else comes and puts it even in a better state. So the possibilities are endless now with AI. You can come with raw data that you don't even know where to start from sorting. Once you have the prompt, the right prompt, it's able to say, okay, you want to sort according to XYZ, or you don't even know how you want to sort it. There are tools that can actually help you make the decision as to what you should be looking at. Put in raw data. I don't know what this data is saying. What kind of insights can I pull out of this data? And there are tools that can actually help you say, okay, these are the kind of insights you might want to pull because of the patterns that exist within that data. So in healthcare, the possibilities are endless. We have EMRs that we're using today. You have patient information that you want to be able to make informed decision with regards to the population that your facility is serving. AI tools can actually help you do that in a way that they're saying, okay, we've seen that the demography of people who are reporting with high blood pressure, for instance, within your facility are between the ages of 26 to 45, for example. Those kind of information are relevant even in the way that you plan your systems and plan your services within your facilities. Okay, please go ahead. I thought it was important for us to just pause at that point so that we can digest the information and then we move on. Please go ahead.
Thank you. So now we've covered the basics of AI, how it can be used in healthcare, and what type of data we have in healthcare. We now move on to one of the more important sections here is the ethical and privacy issues, and how do we not just use AI, but we use AI properly and not just use it. So we'll hand over to Solomon for this section.
Thank
to
you
take us
so
on.
much. Thank you so much, Abdullah and Miriam, for giving us that fantastic foundation on what AI is and how it can actually transform healthcare. I remember the first time I came across a training like this, also a training around a webinar on YouTube around AI. I was just so basking. I couldn't wait I started feeling like an AI engineer already. And I think that may be the same for everyone in the room, the excitement. But while AI is exciting and powerful, there's another side of the conversation that is just as important, and that is the area of responsibility. Borders on ethical and private issues, because the moment AI enters healthcare, which it has done, it begins interacting with one of the most sensitive things people own, which is their personal data. We always know that the data belongs to the patient. So it's very important that we answer questions like, how do we use AI safely, ethically, and responsibly? So as you can see on the screen, it says with great data comes great responsibility. And we've also learned that AI systems learn from data. Abdullah Mira will agree that the better the data, the better the AI system can perform. So data is incredibly valuable because it can help predict many things. So while a patient presents at the facility, you're triaging as a health professional, as a clinician, you're asking questions to help improve diagnosis. So you're able to know how to personalize the treatment. However, the sensitivity of health data implies that we can't do things anyhow, okay? It implies we can't do things anyhow. Secondly, because we also utilize the personal data of our patients, it can also bring or cause real harm. It can cause real harm. And then there's also that potential consequence of misuse. And so Go to the next slide. And so let's talk about some of the risks, privacy breaches. And every one of us knows what privacy is, or let's assume we know. Privacy is that your ability as a person to, whatever information you share, not to be exposed to other people other than you, except you've given that permission to have that data exposed. And a privacy breach happens when unauthorized people gain access to patient information, and this could happen through hacking, poor security systems. For some of us who are digitally active, maybe weak passwords or careless handling of records, of patient records, either whether it's manual or it's digital. Now that the world has gone digital, the risks are higher. Just one hack and everything is exposed. The second is uninformed consent. And then it's important to mention that, especially in most developing countries in sub-Saharan Africa, many people still do not fully understand how the data is being collected or used. And then sometimes patients or people, many of us who are here, you get on websites, on apps, they tell you accept, you click accept without even realizing that your information may be analyzed by an AI system or may be collected for further analysis. It's important to highlight that within the context of AI in healthcare, true consent is important. Getting consent from users, and true consent means that people understand why that data is being collected. They understand what data is collected, and they understand how it is being used. For most of you who probably have leveraged AI platforms, if you go to the privacy sections, you'll be able to see some of this information where they've explained why they are collecting the data, what the data will be used for, and what type of data will be collected. And the third is the lack of transparency. You know, sometimes AI systems can act like a black box. You know, they give recommendations, but healthcare workers may not understand how the decision was made. It's often said in some places that, and some clinicians will accept or agree, most of them even leverage GPT. We had a study at MDoc 2 years ago where we brought in a couple of clinicians to, we conducted a study to see if large language models, tools like GPT, can be a resource for healthcare professionals. And we found very exciting. We brought both doctors, nurses, and CHUs to see if how well can these large language models or tools be a valuable resource for them. And we found very interesting responses. And even from the focus group discussion, we saw that some clinicians were already leveraging GPT and other, maybe Claude, to support their decision making as they interact with their patients. So, but imagine an AI tool predicts that a patient is high risk, for instance. You know, certain questions can arise like why, which factors influence that prediction? Can we trust it? Is it biased? So trust is everything in healthcare. Please go to the next slide. So if trust is not there, then people may stop sharing important information, or they may, as much as possible, avoid healthcare systems or even reject the use of technologies. And that's why it's important when building AI systems, when building digital tools generally, it's important to build with the communities or the people who will actually leverage those tools. If you're building a clinician decision support tool, for instance, that clinicians will use, so that they understand, to be able to build trust, is important to also design with them. Because once trust is lost, once it's broken, rebuilding it can be very difficult. Now, this particular slide, now in this section, I'll talk about how organizations, how governments may try to reduce this risk through laws, standards, and regulations. And we have, for instance, the European AI Act. We have GDPR and the likes. In some of these more advanced societies, regulations around AI has gone way ahead. in some developing countries, in some countries in Africa, like Nigeria, Ghana, Kenya, South Africa, and the likes, these regulations are still coming up. And the idea is to bring up a rule book of laws and standards that can guide developers, that can guide organizations, that can guide implementers in the use and design of this AI tool. So many of you may have heard of GDPR. If there's anyone, if you've heard of GDPR, General Data Protection Regulation, which originated in Europe, but has, of course, influenced global standards. GDPR emphasizes things like consent, privacy, transparency, and personal or individual control over personal data. Then those of us who are in the North America and the US, many of you will be familiar with HIPAA, Health Insurance Portability and Accountability Act, and it focuses heavily on protecting medical information and ensuring that healthcare organizations also securely manage patient data. In our own country, Nigeria, we have NITDA that plays an important role in data protection ecosystem and just supporting digital governance and responsible data use. Then there's another very, very important for those of, especially those who are active in Nigeria, will understand that at the start of this year, towards the middle of last year, around March 2025, the General Application and Implementation Directive was now implemented in Nigeria, and it brought to an end the combined application of the Nigerian Data Protection Act, Nigerian Data Protection Regulation 2019. And so the idea is to ensure that the privacy of patients are protected, that consent is always generated, and that transparency must always be ensured when developing or designing or utilizing any of these digital AI tools. So go to the next slide. Okay, so let's do a quick scenario. You have, let's sort of make it practical with a simple scenario. You've learned that your facility is using an AI tool that predicts patient outcomes, but you did not know how it works. Would you use it and why? I'd love to see responses in the chat. I'll take that again. You learned that your facility is using an AI tool that predicts patient outcomes. So you just feed it the data, voila, and then it predicts the outcome, but you don't know how it works. Would you use it and why? Love to see responses in the chat.
Yes, would love to actually hear from doctors and nurses.
Doctors, exactly. Yeah.
I remember when EMR was coming out, doctors were like, you people did not consult us. We don't know what you're talking about. We should type. And you know, doctors and that, their funny handwriting that they use when we write on prescription that nobody can read except the pharmacist.
Yeah.
So when EMRs and things like that were coming up, doctors were the people that were saying, so I should go and start learning how to type. So please, I would love to hear from people in the room, nurses, midwives, health administrators. Tell us in the chat if your facility, your medical director comes and says that we're going to introduce a new AI tool that once a patient comes, you can tell whether that patient is going to have a hypertensive shock or something, but you don't know how to use it. Would you even think of using it, and why would you think of using it? Please.
So we have some answers. Dr. Isaac says, yes, I will. All I need is a prompt asking how to use it. Interesting. Saritin said, I'll ask some more questions on the tool and ensure it is within the legal framework and then use it. Olofimla say, yes, yes, it will ease our work. Deborah said, I need to know how before making use of it. Lucy says, I will use it to understand the prediction patterns. No questions asked. Her trust her trustometer must be very high. William says, I'll use it. However, I will still rely on my expertise. Like I mentioned, the study we conducted when we brought in healthcare professionals across different cadres to see if these large language models can be a resource. In the focus group discussion, we had most of the clinicians saying that yes, they leverage GPT and other tools, but they also have to rely on their own expertise or their own knowledge from the things they've learned in medical schools and other evolving research. Esther says, no, I wouldn't use it simply because what if it violates patient rights and dignity to treatment? What if it pops biasness in findings? Okay. Okay, doctor's
Very interesting one,
handwriting.
actually. That's a very
Yeah,
interesting one. And I
yeah,
like the way it's been framed because it just means we're even thinking from a safety and a responsible use of AI, which is exactly what Solomon is talking to. That responsible use of AI. We have the policies, Nigeria and some of the other countries within Africa are catching up to having more strict and more robust policies around the responsible use of AI. But there's also the personal responsibility that comes with, asking the right questions, for example, to
yeah.
your medical director who is bringing the AI tool. Have you tested it? How has it been used? Is there evidence to show its effectiveness, especially within healthcare and things like that? Help open the dialogue and help put in the consciousness of everyone within a facility the importance of privacy, the importance of the responsible use of AI. That's why you will not be sharing your login with a colleague where it is against the rule because there are patient data and patient information that are stored within this tool. So lovely to see the responses in the chat.
Yeah, thank you so much, Dora, and everyone who has responded. And so go to the next slide. So now we're going to just take let's move from a bit of theory into real world healthcare AI example. Like most of us have shared already, we're familiar with some AI tools. We've interacted with some of them, we've used some of them, whether knowingly or unknowingly. And so the next session is just to bring up one case study, and then we can just see what that looks like. At the introduction, Adora did mention that our Complete Health platform, which is one of our 4 pillars at MDoc, is integrated with an AI chatbot called KEM. KEM was designed to support health and wellness, our members being able to access personalized 24/7 coaching support with KEM. There's an interesting story behind how KEM came to life, okay? I'm giving our health coaching model and our health coaches supporting large number of members. Around COVID, the responsibility or the needs of our members started expanding. Everyone remember the dark days of COVID-19 2020. So everyone was at home, everyone had, or majority of people, including our members, had health needs. Everyone wanted to know health information. Everyone needed support. And we thought about it and say, okay, so how can we continue to support our members? And so that we don't overburden our coaches. And so imagine one coach having to attend to more than 100 people at the same time. And so we said, let's go ahead and create a chatbot that can support our members and provide them with that 24/7 and just answer questions, the burning questions that they will have. And then with time, as is common with humans, when you give one, they ask for 2. So KEM started initially as rules-based. Rules-based is I ask you, whatever you put inside is the answer it will give to you. Think of it like an FAQ. So if you come and ask questions outside of an FAQ, KEM may not be able to respond. And then LLMs came in. Fantastic opportunity to expand the capacity and the depth of KEM to provide that 24/7 coaching support to our members. And now KEM is available on the MDoc on our Complete Health app. Encourage you, go to our Google Play Store and download it. So One thing I love about Chem, so I don't digress too much, one thing I love about Chem was that it was built with local relevance in mind. I did mention it initially, and Adora also highlighted it, that you're creating a tool for, say, clinicians without, for instance, EMRs, without bringing doctors into the conversation at an early stage, ensuring that you're co-designing with the people who will utilize that tool. But for us, our human-centered design approach is very critical. It was built with local relevance in mind, and it's even reflected in the name. Chem is derived from two Nigerian languages, or two names from two Nigerian languages. In Chem is Igbo, meaning my own. And then Kemi from Yoruba, meaning pampami. So what it means is our members can, Chem can pamper our members, and our members can also own Chem, like have it at their beck and call 24/7. At the early years of while we're still building our Chem, conducting user testing, rapid iterative user testing cycles, at some of the FGDs, we had women say, oh, can I take Chem home with me? And we said, calm down, we're coming. Chem will be on completed app, and you'll be able to take it home with you. As you can see, the cultural grounding is important, because healthcare technologies would, of course, work better when people feel represented and understood. Some of Chem's goals include providing timely, understandable health guidance, improving health literacy. Chem can teach you, it can direct you, it can guide you. Then, of course, supporting chronic disease management, supporting people, helping them achieve their personal goals. Interesting also, Chem can communicate in multiple languages. Okay, so go try it out. For me, every time I engage with Chem, it's Pidgin, and we're rapping. At the user testing we did recently to check and get our users to tell us how they feel about the voice and Pidgin, someone asked a question around Agbo, and he was expecting Chem to say, what do you mean by Agbo? He was shocked. An elderly man of, say, 55, between the ages of 55 60, said he was shocked and very impressed that Chem understood Agbo. And Chem was able to tell him that your fathers or your parents took Agbo for malaria at a time when enough information was not available. However, research and there are now advances in medicine that now says, go to the hospital, see a doctor, and let them prescribe a good or the right drugs for you. Chem is important. Chem is not designed to replace healthcare professionals. It is designed to extend support and improve accessibility. So at the middle of night, 2 a.m., 4 a.m., the woman at home does not, maybe there's a health emergency or anything, go to Chem, ask questions, and Chem also refers and escalates. And Chem is able, now it's also, we did talk about ethics, privacy, and the rest of them. AI systems can make mistakes, and that's why human oversight, clinical evaluation, safety guardrails are important, remaining essential. Go to the next slide. This is just a snapshot of, say, Chem moving from rules-based chatbot integrated with LLM, and then we also ensuring that the clinical guardrails are there, the clinical oversight is there, and we're always testing and ensuring that we're evaluating Chem across various domains. Like we said, Chem does not replace, as should other AI chatbots in health, never to replace clinical care. The idea is to support healthcare delivery, support clinicians, driving behavior change. Think of it that before, like in our own system, Chem refers. So a member is interacting with Chem. Chem can say, oh, you need to go to the hospital. And so, and then suggest facilities, links with our second pillar, Navio.ai, say go and find a facility, tells the member to go to the facility, and by the time the member comes to the facility, for the healthcare worker, because they've been exposed to an AI chatbot, to a health coach that has improved their health literacy, that has improved their confidence, their knowledge about certain things. We have doctors, healthcare workers say, there's some patients are difficult. They come in and it's a struggle. But then having AI tools like Chem engage, drive digital literacy, health literacy for members. Imagine such patients coming to the facility, patients coming with better understanding. They're able to answer questions that you pose to them because they understand the importance of saying it the way it is so you can understand where it hurts and be able to provide the guidance. And then when they leave the facility, Ken is now able to come in and drive adherence, drive nudges. Ken is able to nudge the woman and say, you went in for this, you're supposed to go back for this, you're supposed to take your medication, you're supposed to exercise, because most times healthcare professionals, lady, I saw you came back I saw you just yesterday. What happened? And then you discover that they did not adhere to the treatment routine. But now we have AI tools. Imagine an AI tool being able to support adherence, help you as a healthcare worker, so that when the patient has left the facility, it's nudging, telling them you need to do this, you need to do that, you need to do that. That makes the work easier and ensures that this health system is not filled with people who shouldn't even have come in there in the first place. What the screen says, snapshots of people who tested during our user testing cycles, like we said, human-centered design, rapid iterative user testing cycles. They come in, they test, they tell us where the pains are, what we need to improve on in their own voice. And that also helps us to keep improving the capability and the performance of Ken. Thank you so much. I will stop here and over to you, Adora.
Thank you so much, Solomon. Thank you. That was really, really, really insightful. And I see a lot of comments in the chat. Yes. So I think the last question I saw was around Kem helping you find facilities closest to you. Yes. So Kem can currently link you to our navihealth.ai platform that tells you about the facilities in your area. In fact, what we're currently working on now is the next deployment is to actually list for you the facilities around your area. So that's why it's important. If you're a medical professional here, you're a CMD of a facility, you need to be engaging with us so that we can actually geocode your facility on our navihealth.ai so that it will be part of the facilities that come up when people are looking for a particular service. If you are a pharmacist who runs a location or a physiotherapist, you have a service, we will be able to geocode your service on our platform that allows people find your service. But after finding your service and they use it, they come back and they give you a review that allows you to see what people are saying about your work, the feedback about their experience within your facility, and it will help you continue to strengthen and improve the quality of care you provide. This has been very interesting. Even if I say so myself, I'm sure that, again, like I mentioned, this is just the introduction. So there will be more to come. We want you to please keep putting your questions in the